So as you were sharing some of your experiences in regards to your community context as well as your resources and capacities, some common themes that you mentioned really I think that might be important to note across you. We're really thinking about collaboration but contingencies for collaboration, such as with grant requirements and mechanisms that put a little bit behind coming to the table. Additionally, having some paid staff, so you talked about collective impact specialists, you talked about, and other resources such as the TA and the backbone organizations, so supporting the infrastructure. Collectively, you also mentioned providing opportunities to engage those in the communities in which you begin to shift the power differentials, so helping to move into the positions of perceived power, such as you were talking about Yesenia, or even with the forestry program and having youth to build their skills and expertise so that they can become leaders in some ways. And so you all had common themes related to that, as well as the trust building. Sometimes I think we think about it as build it and people will come, but you're talking more about go into the community where the people are and engage at that level, as well as having a maintained presence. And that means going across grant funding mechanisms, across staff and personnel, and showing that there's commitment in the community. And then a couple of you really were talking about thinking about the determinants of health. So we need to be addressing health, but defining that with our community as to what health means for us and in our community, and thinking about determinants such as early childhood, education, and some of the others you named. So thank you very much for that. So now we're going to move into thinking about what some of the principles and practices are as we think about engagement and thinking more about power sharing, as well as how you build and extend relationships and bridges. We would love to learn from you with that. And as you're telling us about that, if you maybe could integrate some of the barriers and continue to integrate some of the barriers you've experienced and you've experienced. So we're gonna try to do some interactive activities also to get some of the Commonwealth knowledge from who's in the room. So with that, Stephanie, we'll give it back to you.
Great, so we're going to do a very quick activity, and very quick. So essentially, everybody has sticky notes on their tables. There's two different questions that are up here, actually. So question one is, your agency is forming a coalition on child health and wellness in the community. Who do you invite? Question two is, indicate 3 ways and approaches you will use to share power and ownership within the group. So I think there's a lot of knowledge here already, so we first wanted to hear some of your ideas, and then I was going to share some of the best practices my organization has done in 24-1 as well. So what we'll have you do is these first 4 tables, if you could go ahead and answer question 1. And there's actually an easel here, so what we're asking you to do is, in each group, come up with answers together, come up with those sticky notes, and then put 1 answer on each sticky note. And then after a couple of minutes, we'll have 1 representative from each of those tables go and organize those notes on this first easel right here. And then for the second group, so these last 5 tables, if you could go ahead and answer the second question, indicate these 3 ways and approaches you'll share power and ownership within the group. And again, same thing, each group will come up with answers together, and then 1 representative will go ahead and help organize at that back easel with the other group members. Does that make sense? Do you have any questions? Okay, great. So we'll have, oh, go ahead. Thank you. Well, a couple of minutes. Yes, so I would say within 5 minutes have done this in the group and gone to the easel. So I would say about 2 minutes here and about 3 minutes there. So this is very quick. We don't expect you to have all the answers, but just at least your initial ideas, and then we'll debrief after that. Which I think
have something come up, transmission goes down, it's not hard paying my rent. Baseball, furniture. They do what they want to do. I mean, yeah, I mean, they've got all the lobbyists that work in the legislators, and they've got just lots of power. So, I mean, you might start off with a 27% interest rate. Miss a payment, it might go to 150%. I mean, it's just, there's no limit.
Yeah, no, we have no limits really either. They're trying to do some local stuff, but they don't have local authority to do anything about interest rates. So when the city is doing actually is they're adding $1,000 annual operating fee to any payday lender, and then also requiring that they give them information about things like rent.
What would they do with that $1,000 annual?
For compliance, to make sure that they're both providing.
I'm saying, what is the city going to do with the money once they bring it in?
It'll be more for compliance to make sure that they're. Yeah. I can do it. All right, we're going to start a report back. So even if you haven't been able to put all your information up there, we're going to go ahead and just go through some of the answers just to be good on time. So we'll start off with the group 1, I guess. So that would be question 1. Do we have a volunteer from group 1 to just share at least, if you want to either read it off or give some of the highlights of some of the groups there? We have a volunteer? Yes. All right. I'm going to hand you, oh, never mind. Go ahead.
We talked about hospital, housing departments, school districts, child care providers, I can't see, Head Start, public health department, behavioral health department. I can't read all of this. No. Youth, community members, health advocates, faith-based community, fire department. That's, I guess, enough.
Wonderful. Thank you.
You want us to read the other ones?
And were there any missing that she didn't know that the other groups know?
No, we just said everybody.
Okay.
Well, yeah,
They're very inclusive.
somebody else had community college, grandparents, organizations representing different races, policymakers. Let's see what did green have.
Great.
We didn't have gynecologists. We did. Social services in general, I guess. Coaches.
Great.
Thank you.
Thank you very much. And then we'll go ahead to the back group if somebody could volunteer to read or summarize some of the answers that you have there as well.
Let's see. So I think some of it, we definitely went beyond the 2 or 3 that were recommended, but we had a lot of great ideas in all of these groups. So a couple things, developing group principles, so jointly working on what you were going to be working together, developing a situational analysis at the start so that everyone was equally participating and contributing to the process. Making sure that the language accessibility for non-English speakers is something that is common across all of the things that you're using. Don't assume that, I don't know what that one means, don't assume equal to power. Who wrote that one, just out of curiosity? What did that mean for you guys? Oh, got it. Okay, that's a good one. Let's see. Rotating the meeting sites, so using different sites at each group. And let's see some other ones. Processes that enable trust and participation, transparency about how decision making happens. And then expectation of individual reflection on positional power. So it sounds like that one came out in a couple of groups. And let's see, group decision making. So I think some of the common themes.
Great, thank you so much. So I think all of you touched on a lot of things that my organization does as well, and I'm sure a lot of the communities represented here. I think just a couple of things to add. One thing that I really wanted to get through with the first activity, or group question 1, was just the importance of really inviting a lot of, I guess, more grassroots perspectives, community perspectives. So essentially making sure that you're not having just health professionals deciding for the community, but you're also having a range of expertise, whether that is from youth football coaches, from local food pantry volunteers. We have a boxing gym instructor in our group. I mean, these are some of the perspectives that are really helpful, both in understanding here's what might actually work, but also bringing some of the ideas into action as well. One of the other points for question 2, again, those are really great ideas, and a lot of that work our organization has done as well. A couple other kind of smaller logistical things that we do to try to share power, especially at a coalition meeting, for example, is we make sure to include everybody, not everybody, but we add other voices to the agenda. So it's not just one organization reporting out on everything, making sure to have subcommittees where different members can serve as chairs, and also doing one-on-one meetings, because we recognize that not everybody is comfortable with sharing in a larger coalition meeting, but they might be more comfortable on these smaller one-on-one or group meetings. One other thing is really the social experience. So one thing we really work to do with our meetings is make sure it's interactive, doing activities like this, but also making sure there's food, both to get people to want to come, but also to have opportunity for people to share and to really get to know people they might not normally meet with. And then finally, having times for you to celebrate, whether that's with, for example, different group campaigns, with things like volunteering for the food pantry, just different opportunities for people to really give back to each other's organizations or volunteer activities. So I think that's about all I have for now, but thank you again for sharing all of your thoughts as well. And any other final thoughts?
Wondering about challenging ourselves to not only think about attracting like-minded people in the same room. In fact, maybe we have a problem with that. I can tell you that there are particular challenges when you have an anti-tax advocate or a small government advocate in the room with people like this. It becomes a challenge, but it'd be probably in this day and age, and maybe going forward, it may be a necessity.
Thank you. I think that was a good point and observation from some of the processing. And so, Shelton, if you would layer on some, and
I want to talk about asset framing. Oh, yeah, thank you. I want to talk about asset framing and language that we use in the populations that we work with. Did it again. All right. It's the bottom button, not the top button. So this is a pretty common mission statement. I found this just Googling around. And the words in red are words that I'm going to start by saying that foundations use, and I've heard it said, blood money for blood work. And I think this isn't a pointing at the finger, because we all are guilty of being in this way in which if an RFP is released, it generally talks about the people that are being worked with or worked on from a very deficit angle. I really liked the work that you all were doing in Wisconsin, because one of the things that stood out about you all's presentation was I didn't hear any of those words. And I wondered to myself, why is that? Is it because 97% of the population is white? I just asked that question to myself. And I think about, if that's the case, I'm not saying that you all would do that if you were using a different population, but I'm saying that in other workspaces where the population are defined by terms like minority, right? I think about that word, like my mom never looked at me and said, my minor baby is here with me. She's proud of me, right? So typically, this is who we are, and this is who they are. And it's difficult to see people as an asset and a deficit at the same time. But you have to choose one, right? You have to choose one. So if you all don't mind, could you please stand? And I need you to look at one person. So those of you all that are online, I'll ask you to look at me. And please, don't look at me. Listen to the sound of my voice. If anybody's ever been to a church, a black church in particular, don't look at me. Listen to the sound of my voice. Look at your neighbor. Look at him. Don't feel uncomfortable. Look at your neighbor. No, just one neighbor. Just one neighbor. Don't look around. Find one neighbor. Okay. Now, to that neighbor that you're looking at, please tell that neighbor what's wrong with them. Right. No. You can have a seat. You can have a seat. You can have a seat, right? You can have a seat, right? Right. So when I do a job interview, I don't tell them about that, I wet the bed, right? I give my best self, right? And so how do we reshape the language that we use when talking about the communities that we serve? And this isn't like a wordsmithing, right? It's not like, okay, I'm going to, instead of calling them at risk, I'm going to call them children of promise, right? But it's about recognizing what are the values. Like the families that I work with that I talked about out of the Park Hill Housing Project, I could tell you that prior to coming here, there was a shootout. Or I could tell you that that mother cried tears when her 11-year-old Forrester was leading adults in how to plant a tree. Like that's the narrative. Like that's who they are at their core. And if I keep framing the conversation around high risk, underserved. I keep anchoring folks' thoughts to actually undeserving. And then I actually create a workspace in which there is no sustainability. I have to come in and save these people. And you see it all in our language. And none of us are exempt. Please don't feel like I'm pointing out any one particular person. This isn't even a black or white issue, right? If I pulled up, actually that mission statement unfortunately came from a black, named after a gentleman's nonprofit, a black man who was named. I mean, and the language just like, I just used portions of it. Like it just got worse and worse and worse, right? So asset framing is trying to shift that, right? And asset framing is about rejecting narratives that denigrate people and work together to build a better society, right? And I understand, like, we're struggling with this asset framing in our community because the nonprofit industrial complex, right? Like how do you, like, because they're going to release their RFPs. They're going to use the language that they want to use to talk about the families, right? And how do you challenge that norm, right? How do you release your annual report without sounding like you're Superman, right? Nobody needs Superman. We need partnership. We need community. We need collaboration. That's sustainability, right? No more blood money for blood work. Thank you all.
Thank you, Shelton, for a provocative exercise to help us to think about that. Some of your faces was priceless. So, Yesenia?
Thank you. So I'll talk a little bit about some of the principles of engagement first. I think a lot of us touched on it, but a lot of the things that I've been finding out just recently talking to community partners is, wow, how did you get 50 people from the community to come out and tell you, or, you know, sometimes we hold focus groups, like, tell us, you know, community members, tell us how did you do it? And, you know, we talk a lot about, well, how do you recruit people? We have a local community station or radio station. That's a local nonprofit where a lot of our DJs are really popular. So we get them to invite the community. There's going to be this event. We're going to have dinner. It's going to be after hours. So after work, after 5, 6, when people can take a shower and have a little bit of dignity and come and feel good about themselves. So after hours dinner, we provide childcare and we provide a stipend for their time because we're asking something of people and we should be giving something back. So those are things that are essentials for us and always report back. So whatever we're asking the community to inform us on or to tell us about or to share stories, we always explain what the project is, what the community is doing, and then offer a space to report back on the results or whatever happened, right? And I think those are things that are very important for all of us to always keep in mind, is not wanting to expect so much from our community that we exhaust and that we take almost advantage of their time. Also, again, using the community health workers who are our trusted members of our community that go out to do that recruitment piece. I think a lot of times too what happens is that our leadership is mainly white, and it's people that have just newly moved into our region as a CEO, and there's such high turnover in that leadership, and you know, and so using the community health workers that most of the time are born and raised there and a part of the community is such key for community engagement of people that live there. Clear roles, clear missions. You know, we can't just bring people to a table and tell them we want all this information from you because blah, blah, blah. We have to talk about our goals and talk about our mutual benefits and also building the agenda together. We're here. This is what we would like from you. What do you want from this meeting? So it's a give and take relationship. sharing of resources. Sometimes because, for example, I work from a nonprofit, those community partners that we work with sometimes have bigger space. So let me borrow some space and I can, you can use this group as a focus group too for whatever reason, and sharing of resources. And something that's very huge that our community health workers always use is popular education. Is anybody familiar with popular education? Raise your hand. Not a lot of people. If you have a chance, research or look that up. It's a teaching methodology that's based on social justice. So it really, instead of when we hold meetings with our community members, instead of sitting down and lecturing like you would typically do in a normal school setting in the United States, we gather in a circle where we can all see each other. And if we're going to talk about San Francisco, we say, what do people already know about San Francisco? People share whatever they know, and then we offer, and then we kind of demystify, like, oh, I don't know that San Francisco is all white. I don't know that that's true. We kind of go as a group and we talk about what's true and what's not on the list. And then as facilitators of the group, we kind of offer whatever that's missing from that list. But building on the knowledge that's already in the room, having more interactive ways to teach things so that people can retain more information and really to respect the different learning styles of the groups. And then Rick, where'd she go? I don't see her anymore, but one of the people that was on the first panel was talking about the historical trauma. And I think it's always very important to recognize that and not go into a conversation and ignore that. Especially we've been doing some work with Native Americans in our region, and you can't just go in and start talking about solutions. You have to recognize the trauma that has happened and the things that our systems have done and start there. And recognizing and allowing that space to heal is very, very important. Sometimes, especially for our community that's very rural, we have a lot of transportation issues. So getting people to our meetings means, do you have transportation? And sometimes policies don't allow us to go and pick up people depending on where you work or if you have taxis or if you don't. So that's another thing to always consider too with community engagement. What else? And then really just working with that, also that first panel who showed that inverted pyramid, right? We're really giving the people power, and what does that mean and what does that look like? I brought these papers and I put them in the back of the room, but it's really, it's called an equity and empowerment lens, and it's from a local organization, a division of diversity and equity, and it really helps you look at the issue or the decision that the whatever group is going to address, and then asking all these questions about the people, the place, the process, and the power. So one of the questions to ask yourself on their process, for example, is how are we meaningfully including or excluding people who are affected? Because I know I've been in rooms where people are talking about how to address underage drinking, and there's no youth. Like, how are we talking about this without? So this is a really good lens to kind of keep in mind when you're thinking about how to really engage community. For building relationships, again, it's the clear roles and understanding of why we're all together in the same table and what we're gonna try to accomplish, and really humanizing our conversations. So a lot of times, I think somebody talked about it earlier too, with starting with, intros sometimes. My name's blah, 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 and my favorite snack is, but building that relationship with people that's so important than just business all the time, and really getting to know each other and building that trust. And we've started to use popular education methodology with our CEOs and doctors and all those people that are in our groups, and it's always so funny because people are so uncomfortable, like, I don't want to play games, like, let's just talk about what we have to do, right? But it's always really fun, and I encourage you all to look into popular education. And so with that, that, I'm going to go into some challenges and barriers, and I'm going to do a dinámica, which is a movement building activity. So, and it's also one of the methods that people use in popular education to teach something or talk about something. So this is a cabbage. We're going to imagine that it's a cabbage. And I'm going to throw it to somebody. We're going to have some music playing. And when the music stops, whoever has a cabbage in their hand is going to open up a leaf and read one of the barriers and challenges to effective community partnerships. Right? And so we're going to stand up for this one.
De colores se visten los campos en la prima.
Lack of trust.
De colores son los pajaritos que vienen de afuera. De colores es el arco iris que vemos lucir y por eso los grandes amores de muchos colores me gusta. A mí y por eso los grandes amores de muchos colores me gustan a mí.
So thank you for participating. That's the first time somebody gets hit in the face and coffee spills. So I'm sorry about that. This never happened before. Does anybody have any questions on any of those? I think they're kind of self-explanatory, but if I can answer anything, yeah.